Alteplase TPA clinical uses is a thrombolytic medication. Thrombolysis, also called fibrinolytic therapy, is the breakdown lysis of blood clots formed in blood vessels using medication. Alteplase was approved for medical use in the United States in 1987. One used to treat acute street elevation myocardial infarction, a type of heart attacks, to pulmonary embolism associated with low blood pressure. 3. Acute ischemic stroke. For blocked central venous access devices CVAD. Common side effects of Alteplase are bleeding, including intracranial bleeding and GI bleeding. Other side effects may rarely include allergic reactions. It is not recommended in those allergic to gentamicin. Medical uses of Alteplase. 1. Ischemic stroke. 2. Heart attack. 3. Pulmonary embolism. For blocked catheters, Alteplase can be used in small doses to clear blood clots that obstruct a catheter, reopening the catheter so it can continue to be used. Dosage. The defined daily dose is 0.1 gram by injection. For massive pulmonary embolism, a dose of 50 to 100 milligrams over 2 hours has traditionally been used. This, however, may be given over 15 minutes, and some recommend basing the dose on weight. It can also be given as a bolus in cardiac arrest. Contraindications of Alteplase. Alteplase is contraindicated in those with bleeding disorders that increase a person's tendency to bleed, and in those with an abnormally low platelet count, active internal bleeding, and high blood pressure are additional contraindications for Alteplase.